VLDL, the fat triglyceride-rich particle, can crash into LDL. Eventually, now LDL doesn't disappear and wear out with that, it just becomes small and hard. And so we can predict who has small dense LDL from the triglyceride levels. So as your triglycerides increase, if they're above 1.5, this is the percentage of your LDL that's in the small dense form. And see, patients that have triglycerides of 2.5 or 3, virtually all of their LDL is in the small dense form that the liver wants nothing to do with. It has to hang around in the blood to find another home, and that home is probably going to end up being your blood vessels. The problem with LDL is that we change it. We might change it by making it smaller, we might change it by oxidizing it, in those inflammatory terms, or smoking and oxidizing it. And it has to be taken up by something, and it's taken up by the immune system, like macrophages. And the immune system sort of lines the blood vessels of the body, keeping security, like there's rubbish in that blood vessel, let's gobble it up. Yeah, but if there's too much rubbish, you're going to end up with all the rubbish in the blood vessel. These are just some pictures of actual, LDL particles that are supposed to go back to the liver. They're going into the pits of the liver. If it's a small dense LDL particle, it won't go into that pit, it just comes straight out. And when we're talking about small, don't imagine that it's big and fluffy and small and dense. They're words that we use to exaggerate the situation. The difference is, if you can tell the difference between those two spheres there, that's the difference. Their difference in size by the same amount. It's a very subtle change in that size of the sphere that means the liver wants nothing to do with it. It's 26 nanometers compared to 24 nanometers. That presence of the small dense LDL correlates with all of the cardiovascular risk marker, your blood pressure, your weight, your insulin levels, your glucose levels. And here we have all of the particles in this patient's blood. So here is the smallest particle, it got right into the gel, that's the HDL particle. Here is the next smallest particle, which is LDL, and there's a particular, that's the bad LDL, the small and dense. This patient fortunately hasn't got any. And the normal LDL in the yellow. Up this end is this VLDL particle, the triglyceride-rich particle. And in here is something called the intermediate density particle. Remember that VLDL has to become LDL? It goes through this intermediate density form. Now, when we use the Friedewald equation, we assume that nobody has any IDL. But everyone has IDL. Now, this patient here is not so good. This patient here has got this LDL form, which is smaller. It's got deeper into the gel. That's small dense LDL. And they can quantitate in the report. That red part is what you don't want to see.